And I'll just take a roll call to confirm everyone's here. Good morning, Commissioner Cameron.
Good morning, everyone. I am here.
Okay, and Commissioner O'Brien, who's taking a step away from her vacation. Good morning.
Good morning. I am here.
Okay, and Commissioner Zuniga.
Good morning, everyone. I'm here.
All right. Well, we'll get started then. Thank you, everyone. Thank you, Austin and Vivian. Today is August 26th. Happy vacation to Commissioner O'Brien. Public meeting number 353, call to order. And we only have two items today. One that we're taking care of some more urgent business, and another that really merited its own discussion today. So thank you, everyone, for joining. We'll get started with Loretta. You're covering for Nikisha today. Who's on
That's
vacation.
right. Thank you, Kathy. Good morning, everybody. And thanks for putting this matter on the agenda this morning and hearing it. So I'm here to make recommendations regarding requests from Encore Boston Harbor for 3 amendments to its gaming beverage license. The 3 requests are for 3 new establishments that will operate in the sports lounge area, which has been under construction. I updated you on the gaming aspects of this area at last week's public meeting and informed you that Encore has announced it anticipates opening this area to patrons on September 4th, the Saturday of Labor Day weekend. And this opening, because it involves gaming aspects, is of course subject to IEB approval. Today, however, I'm here with respect to a non-gaming matter, and that is the beverage license amendments for the sports bar, the Shake Shack, and Frank and Nick's pizzeria establishment. First, the sports bar. This amenity is to be operated by Encore. The manager of this area has a key standard license issued by the commission, and the license is in good standing. Our gaming agents, led by Louis Lozano, have performed inspections, including areas where the alcohol will be stored and secured. And our team has also inspected to ensure adequate surveillance camera coverage. And we recommend that this amendment be allowed. With respect to Shake Shack, you may be familiar with the establishment. Generally, this license amendment would be for beer and wine only. The company is a registered vendor to Encore, and as such, the company, through its general manager of the site at Encore, is jointly responsible for the license. The documents in your packet indicate that the manager's license is pending, but since the packet was put together, the manager has had the registration fully issued. Also, I can report that Nikisha Skinner, our licensing chief, has been in communications with the company about its responsibilities under the license. And similarly to the sports bar arena, Lewis and team have conducted the security and storage and surveillance inspections and are satisfied with those. And we recommend that this amendment be approved. Finally, on to Frank and Nick's. This is a casual fast dining restaurant, again with beer and wine only. That company is registered as a non-gaming vendor, and as such are jointly responsible for the beverage license along with Encore. The establishment is owned and operated by the same 2 individuals who own and operate Fratelli, both of whom have the appropriate credentials. And the manager of this restaurant also is credentialed and in good standing. As you recall, the IEB recently reported to you about a compliance matter that had issued with Fratelli's regarding issues around the restaurant's employees not being timely credentialed. In the past few months, the compliance with the registration requirements at Fratelli's has been met and achieved. And with respect to the new establishment, Frank and Nick, an individual, an attorney, has taken on the responsibility and the role for ensuring that the employee registration requirements are met at Frank and Nick as well. And as, of course, the licensing division will continue to work with them, and we recommend that this amendment be approved. I do want to point out that it's critical that these employees at these 3 amenities being involved as they are in the service of alcohol, that they undergo the TIPS training or other credentialed training to be approved by the IEB, and that they become certified prior to commencing any duties. And Encore has already been proactive in providing the requirements to to all three, but of course to the two vendors critically, and instructed them of their requirements for compliance, which is part of Encore's internal controls. So we will be following that as well. So happy to try to answer any questions you have, but the IEB does recommend all three be approved at this time.
Commissioners, Lewis is available too for questions. Thank you, Loretta. Commissioners, any questions for Director Lilios or Renzo?
Yeah, I'd like to just like a couple of questions for perhaps for additional context, Loretta. Thank you for that great summary. The area which was all of the prior buffet area had a prior alcohol service. Is that correct?
The buffet area did have service. So the amendment really goes to the sports bar because it's a whole new amenity, entirely new structural area as well, and new method of service as well, with a bar as well as servers bringing to patrons as well.
Yeah, no, I recognize that at the buffet you could not essentially leave the premises prior to re-entering, and this now becomes a bit of a possibility given the open nature of the layout. Is that correct? Also, there will appears to be service that you can come to the counter and take with you in a couple of these venues, correct?
That's exactly right. Certainly at Shake Shack and at Frank and Nick, that is contemplated.
Thank you.
Commissioner, can I ask, so that I'm thinking how you might be thinking, do you have an additional concern about that because it is different in terms of this issue?
No, not a concern at all. I was just pointing perhaps for the record that in some way this area mostly was licensed already, given the buffet, but both, as Loretta said, because of the layout and the manner in which now the service is conducted in a couple of different, and one of those spaces is leased to another entity that has also been licensed, that all of these revisions to the license are appropriate. I was just noting it perhaps for the record and nothing else.
Commissioner O'Brien or Commissioner Cameron, any questions?
Thank you.
Cameron.
Yes, thanks. Director Lilios, you gave a very complete summary. It doesn't sound like there's anything there that gives you or your team pause in moving forward with this licensure. Is that correct?
Yeah, I mean, the recommendation is that all three be approved. We certainly will continue to work closely as these establishments near opening to ensure that all the employees are in fact properly credentialed and trained. But all of the requirements under the governing regulation for these amendments have been met, and the establishments have been entirely responsive. So the recommendation stands.
Great, thank you.
So just one follow-up. You mentioned that I'm pleased to hear that for the Frank and Nick establishment, there's a plan for the making sure there's timely and accurate credentials for the employees. Loretta, Shake Shack, I'm not sure if they have experience working with casinos or not, but are they getting the same kind of sort of any initial training around these issues?
Nikisha has been working closely with them. They have provided the materials and the job codes and so forth that her team requires. We have mobilized GEU to be able to respond to the increased fingerprinting need to make sure that there is, that folks can get through the process in a timely way. So Shake Shack has been educated and has been very responsive to the process.
That's all great. And it sounds like great news too, in terms of some new employment opportunities here.
Absolutely.
That's great. Can I ask, do you know, when they say hours of operation be some time through 2 a.m., do the establishments serve food throughout that period as well?
Yeah, I think they do. There may be a period right before closing that they stop taking orders, but I think the food service continues right up till around closing time. I don't think there's a period where it's bar only, where it's alcohol only.
So that means that perhaps people right now, it's my understanding that the only real bite to eat is at Dunkin' Donuts, not in any way to diminish how good a donut at 1 a.m. would sound. But there might be more opportunities other than the sit down at Telly's.
Oh, absolutely. I think that's part of the model.
That's good. That's great, Loretta. Thank you. All right. So Loretta, you need an authorization from us today.
Yes.
I'm not sure whether or not there was a formal motion made, but perhaps among the
I'm happy to make a motion,
Oh, good.
Madam Chair. I move that the Commission approve the Encore Boston Harbor Gaming Beverage License Amendments 205 CMR 13603I to include the Sports Bar and Lounge, Frank and Nick's, and the
Shake Shack.
yes.
Second that motion.
Any questions, further edits? All right. Commissioner Cameron.
Aye.
Commissioner O'Brien.
Aye.
Commissioner Zuniga.
Aye.
And I vote yes, 4-0. Thanks, Vivian. Okay.
Thank you.
Excellent. And I think they're all slated to open September 4th.
That is Encore's plan, again, subject to regulatory approval.
That's right. Okay. Well, I wish them luck. I know that my fellow commissioners join me, but I know you still have work to do at IEB, so thanks. Okay. Moving on to item number 2. Karen, good morning.
Good morning. So for the administrative update today, we're on the agenda, we're discussing the reopening of the Boston office. As the commission is aware, we have had employees on site at the 3 casinos, and the racing employees have been there along with the state police. So we have the issue of the Boston office reopening for you today. There are 3 components, and they all kind of blend together as far as the plan going forward, but they each require some discussion amongst the commission. The first is that what we have proposed is a pilot flexible and remote working arrangements policy. And that draft policy was put together by the working group that the chair requested, and that included Commissioners O'Brien and Cameron, Loretta Lilios, Derek Lennon, Tripti Banda, Todd Grossman, Katrina Jagrup Gomes, and Joe Delaney. So we have been meeting and we have a draft of a policy for discussion, the commission's consideration. The other 2 items are, I do have a memo with a recommendation on vaccination mask wearing policy. That would be a directive from the commission to draft a policy in compliance with the commission's directive on that. And then we would come back before the commission with the actual policy. And then the third item is the actual reopening date and what is the plan for reopening. We put that last because the other items up for discussion may impact the reopening date and what the commission would like to do. So, Madam Chair, with your permission, I thought it would be helpful if I just sort of highlighted some of the areas in the draft policy that the working group sort of identified as maybe potential for commission input. and approval, and we can go from there unless there's another way you'd like to proceed with going forward.
Sounds good, thank you.
The other thing, would it be helpful to share the screen, or do commissioners have the policy accessible? I can do either way.
I have the policy. Does everybody have the policy?
Yeah, I have the policy with me. It's fine.
Okay. All right.
I have it as well, but I actually like the screen share because you have highlighted areas that we kind of focus on. So that's okay.
All right, so why don't I go through that, and we can just go through it, and any questions, and I have the group. Katrina is unavailable this morning, but I think the rest of the group is available. Any questions, and just encourage folks to chime in on thoughts, because this was the collective effort, and we recognize this is new. This is, what we're, doing for the as a result of the pandemic. This caused some changes, and so this is a pilot policy, and I think that it's helpful for us to understand that the recommendation is for a pilot, so it's a test period to see how it goes. So some of the things in here we're putting in there so we can test it out, and then get some feedback and sort of do a data-driven analysis. Does this work? Does it not work? What adjustments do we have to make? Because we may have to make some adjustments. Just because we're doing this now doesn't mean that it's forever. So I think that that's important as part of the recommendation. So why don't I share my screen here? Make sure I get the right one. Can everyone see the draft policy there?
Yes.
Okay.
Yes.
So I'll, the first item, which is in highlight, but we do have sort of the start date, the month. We'll put that in once the commission decides on a start date back in the office. So that'll be for item 3A, little 3Is. We have the policy statement, which is that the commission's committed to providing a working environment that ensures the agency's needs are met while encouraging retention by affording employees the best possible opportunity to achieve positive work-life balance. And the MGC also recognizes the many benefits to the agency and to employees by having in-person interaction in an office setting. With this goal in mind, the MGC has created a pilot program allowing employees to request flexible schedules and/or hybrid work arrangements, noting, however, that not all positions lend themselves to a hybrid work option. I think that's something, we need to recognize. There are jobs, for example, the gaming agents, the expectation would be that they are on site. That's their job, and that's how they do their job. So we have to recognize there are some that may be able to take advantage of this, but there may be others that will not. So with that in mind, the other piece of that, just to recognize, right now we have mandated most employees that are not on site, because most of those to work remotely. So this is a shift in that dynamic where it is we will have the offices open at some point, and we will have space available. So this would be at the request of the employees. If they would like a hybrid option, they can work with their managers and request it. But we are not mandating that anybody work at home through this policy. Any questions on that? Does that make sense? Okay. So, you've seen, I won't go through this line by line because I know you've all read it. One of the issues, which is slightly different, identifying the core hours. And those are hours in which employees must be available during their 8-hour workday, because we are suggesting for this test period to test if we could have flexibility on start time and end time. Particularly now with the, with the pandemic and commuting, that may be something that would be helpful to employees. So just highlighted that the potential hours are down below, but there are still expectations. Employees still have to put in their 37.5 hours a week. The offices would be open from 9 to 5, Monday through Friday, and then the core hours issue. So the recommendation, and we can modify this, but that people who are working would work between the hours of 7 a.m. and 7 p.m. So they need to get their 7.5 plus their half an hour mandated lunch break within those hours. We can adjust those if the commission wants to adjust those. This would be a test period. It does have that all employees must be available for MGC work hours from the hours of 10 a.m. to 3 p.m. So that would have to be available. Those can also be modified. For example, if you wanted this sort of start time to be a little later so people could wait for the rush hour traffic and maybe get in a little later, you can modify that. So maybe I'll pause there and see if the commission is comfortable with those hours. If they're good with that, I'll move on to the next item. But this is a sort of a test period to see if that core hour concept would work. Does anyone have any questions or comments?
Questions, commissioners? I have a question. Is on the core. Do the core hours extend? Does this assume already the 2 or 3 days? Or are there particular 2 or 3 days, or is it any 2 or 3 days?
So this would be, yes, that's a very good question. So this would be potentially, we could modify it, but any day. So if you were working remotely, you could still do the modified schedule, or if you're in the office. But there certainly is discretion under the policy. You could have core hours only apply to remote or only apply to in-person. So there certainly is flexibility if we wanted to test any of that out as well.
Can I just ask one more question? Does each individual have to sit down with their manager and go through this, or is it the reverse? Or is it just a given that you can establish it yourself?
No, the intent of the policy is that the manager has to take responsibility and work with the employee to make sure that the agency needs are met and the work is getting done. So this, and it's been interesting, doing some reading, talking to other executives, other agencies, sort of that concept that this does put more of a burden on managers. Managers will need to manage because there is more flexibility. So there is an inherent component to additional management responsibility with this. But yes, the concept is that the manager has to make sure that this works for the agency and the employee. So they have to sit down and work it out together and then come up with it. And the manager would initially approve it, and then it also has to be approved by the executive director. Does that make sense?
Yeah, so the executive director weighs in. Got it. Thanks.
Yes. Okay. So the other line here, and this is sort of red and highlighted because I think this is one of the key issues that employees are interested in. So the recommendation suggestion for the pilot program is that line level employees request an average of up to 3 days of remote working per week, and managers can request an average up to 2 days of remote working per week. Coming to that sort of recommendation or test period suggestion, a lot of that from my perspective comes from the governor's. His policy on average had about 2.5, so this sort of matches up, and then it also gives sort of a testing ability through the pilot program. So we've got more burden should I expect be on managers than line level employees on the remote working. And this way we can see hopefully the difference between 2 days in the office and 3 days in the office, and that the average comes out to about where the executive branch is coming out, which I think was approximately 2.5 days a week. And there certainly it varies in state government what the recommendation is for hybrid working and how many people are in the office. We do not have the same constraints that we're looking at in the executive branch, where they're looking to potentially shrink the footprint. Because we are locked into our lease for the time being, we do not have the issue of having to move people for space reasons. This is really sort of a test period for how does this work? How does hybrid working, is it super effective? Are people really happy? Does it, or are there issues? Is there, are there tech issues? Are there things we have to resolve? And this is, so that's sort of where we came down on the recommendation for this test period, but certainly the commission can alter that if the commission so desires. So any questions on that? Because I know that's the heart. This is a really significant issue potential for the employees here. Any issues? Okay.
Just a comment that I think I'm very comfortable with this recommendation, the way you outline it in terms of the pilot, and see what what comes to fruition and see what what we might need to modify if necessary. But I like the way it's parsed out with the flexibility.
And to your point, there is also in the next paragraph that there is a caveat that flexible arrangements may be suspended or canceled at any time. We'll have to see how it's going, but we would make every effort to give notification and be reasonable with employees. But given that this is new, we're putting that in the policy because we have to to make sure that this work of the commission gets done appropriately. I am encouraged because work has been getting done in the remote setting. So I'm encouraged that it would be hopefully very effective here.
I wondered if during your discussions it came up, because I agree with Enrique, I think this is important to establish the flexibility. We've learned that we've been very productive with the flexible arrangement. But I also know in my sort of informal surveys and my own informal research that there is something that has been missing in that, the informal collaboration that occurs and innovations that come out of being in person. So I wondered if in your discussions, you gave any thought as to when core groups would be, or, the masses, if you will, leveraging numbers of people, assuming public health issues are addressed. Let's just assume the public health and that we're not dealing with that issue. If there's an idea of having folks come in on at least on one of the days en masse or in more numbers than having them across the 5 days spread out. I just wondered if you had discussed that and whether that might be a requirement.
I can jump in there. Yes, that was absolutely discussed. And I think the working group kept coming back to how important it is for supervisors to supervise. And they know their structure, they know what's needed to be effective. And if in fact that's something that is needed to be effective, I think that will be part of the plan that supervisors put in place. And they, of course, would have to justify that to the executive director. So yes, that was discussed. And again, I think we came down to really allowing supervisors and taking responsibility for putting a plan together that makes the most sense for their work environment and how that work will get done.
And did you also discuss the culture of the entire organization, the benefit of when not just each management unit gets together, but also the benefit of the wider organization culture? And I'm also the follow-up question is if you discussed our commission meetings in terms of whether those should be in live or all remote, et cetera.
Well, I think that no hard and fast decisions have been made about that. I mean, everything's been discussed, but I think it's very early to make those decisions with the way things are on the ground right now. That requires a lot of people to be available in person. And I don't think the working group was ready to make that commitment at this time.
No,
And that's because of public health, or just in terms of? It was a
little bit of public health and a little bit of seeing how this works as we transition to hybrid. We did have conversations about how to maintain the sense of cohesiveness for the office, whether it would be, quarterly staff meetings, things like that would get people in to connect on a more regular basis, given that, the flexibility they have may mean their ships passing in the night more than they are now, or more than they had been. And then we did discuss what if all of our agenda setting and our regular meetings are in person in the office, that what that may mean for a lot of people is, Wednesday, Thursday becomes, days when obviously more people are going to be in. But we felt like that was premature to really, obviously, this commission hasn't made decisions about that. And then seeing how it all shakes out. I mean, it may be that whether it's hybrid or all in person has no impact on, the wording of this document. It just may mean the practical applications for people may be that most come into the office in the middle days of the week.
So I have two comments also on that. One is that I think as far as practical applications of activities for cohesiveness, one thing that we haven't had in a year and a half is in-person trainings. And I think that's a key element to bringing the team together and doing things together and learning. You know, we've done a lot with our IT department. You know, we've done that whole conversion. We've got the, the 360 and all that going on. And SharePoint, there's a huge opportunity for us to get together and do trainings in person. And I think that scheduling those so people can be together is really important. The other thing we talked about is also tracking the information. So for tracking what days people want to be in, what days people are in, are we seeing people generally wanting to congregate, come in on certain days, and does that work? So, part of the pilot program concept is also getting information, because this is sort of a temporary information gathering period. And then, okay, so what do we find out? Like, do people come in? Because, to Commissioner O'Brien's example, I am a proponent that being in the office, if you have something on for a commission meeting, is really, really important. And that's something I'd like to see, because it makes it so much easier for the commissioners in running the meeting. So things like that are going to be really important, and getting some feedback on that will be helpful. The other thing is getting some data. If we are looking, to renew our lease, either where we are or make a difference, getting information on sort of what works and what days and how many people will give us data on what size of space we'll need going forward.
But and just to chime in here too, I think
please.
if you look at the policy statement, it does address, Madam Chair, what you're getting at, right? So the biggest part of the conversations before we ever got into the nuts and bolts were, what are we trying to do here? And that's up at the beginning of the document, Karen, where it's one, make sure the agency's needs are met. Also, balancing that with encouraging retention, because for every person that wants to be in the office, other people that are going to look at jobs that are more flexible. So we want to be a mutually beneficial employer, and we can absolutely accommodate the people who want to be in the office. And it's where's the right place to come down for the people who want some flexibility. But then third comes that piece that you're getting at, right? How do you have a good office environment and cohesiveness without being present? And the current restrictions on health issues haven't allowed us to really have those conversations of how do we get everyone in and what's the timing on that. But that is one of the big factors that we're looking at, and how to balance that. So we're not bringing people in just to bring them in, but there's a purpose, there's a reason to get the office cohesiveness there. So a lot of conversation went into that. And those are the three main things that we were trying to balance. And there was a lot of work done by HR, a lot of work done by legal, a lot of work done by the working group to figure out what other agencies are doing, what private sector is doing, what the health community is doing right now, and how do we get all this into a place that makes sense. I think that's why Karen keeps hitting on, this is going to be iterative. We're not going to get it right out of the bat. We need to be flexible, and managers need to really bear the brunt of this, right? And work with the team and work with the commission to make sure the job keeps getting done, and we're not overstressing one area or understressing another.
Very, very helpful, Derek. I think that you outlined that perfectly, along with Karen and the whole policy. Thank you.
Any more questions on that piece? Okay, so the next piece just highlighted because I think it's of concern right now, because we're not quite out of the pandemic and there still may be issues with childcare and all that. So for the, generally in prior remote working that we've seen, where agencies have sort of started doing that prior to any COVID-19 coming on the scene, there's certainly strict rules about remote work not being a replacement for childcare. So if or elder care or any other work you need to do at home. So it's not as if you can be at home and take care of 3 kids and still be doing your job. But the way we phrased it here, just to be mindful of the situation we're in, is that, it's remote work's not intended to be a replacement for childcare, elder care, vacation or sick time, family or medical, other types of leave. However, currently, the MGC recognizes the need for enhanced flexibility due to the COVID pandemic. So although an employee's schedule may be modified to accommodate family care needs in accordance with other MGC policies, the focus of the work arrangement must be remain on job performance and meeting business demands. So it's the message is that, yes, we will work with it. The job still needs to get done, but we recognize that we're still in a pandemic. And I get it that, there may be an issue with a child that gets sent home from school because there are things going on. So I think the message here is that we're going to be reasonable because we recognize that we're still in the tail end of the pandemic. But any questions on that, or if there's any suggestions for how to modify that, I'm certainly the group's certainly open to that. Anything on that? Okay. And then, so the next piece, this one is a little more challenging, and we've got to sort of figure out that, and that's sort of equipment and supplies. So, I'll put in the, sort of a bottom line is that, the MGC really, as a state agency, can't be supplying a full, complete workstation monitor, the whole thing in your office, and then a whole workstation, all thing at home. It's that, we've got to figure that out. So it's slightly different for people that are in offices and people that are in workstations or cubes, because the expectation, we do have sufficient equipment. If we're doing this hybrid model, people could just take their laptop and have what they have at home and then come into the office and then plug into a workstation, not necessarily the same workstation every day, but there's a solve to that. But we do have in here that employees are responsible for coordinating with their managers to ensure they have adequate equipment to perform their job functions properly during remote work. In some cases, the MGC may assist the employee with recommendations for specific equipment related to their work. So if they want to purchase a monitor with specific connections, a keyboard or mouse recommendation, docking station, if they want to set something else at home, and I think some people have done that during the pandemic, we may be able to provide some limited equipment to an employee on a discretionary basis, but we do have a workstation at your office, and you can come to the office and work there. And if you'd like the option to work at home, there may be a need for some equipment. So, I'm certainly open to any questions on that, or if there's any comments on, is that the right approach? Do we have this right? Did we strike the right balance there? Usually it's more the managers that have the offices there, they may have to purchase something if they want to work at home efficiently. And that's, part of the advantage of having a hybrid option. Any questions on that?
Commissioner?
Yeah, I'm just out of curiosity. I suspect a lot of this was already addressed, but given that all of us have worked remotely, again, with some exceptions, like the gaming agents, is it fair to say that everybody who has worked remotely, they have already found some kind of solution at their home? Either
right. The issue is if they took all their stuff from their office and brought it home, what do they do if they go into the office, and do they just have their little laptop, but they actually work in a job where you need two screens to do spreadsheets and all that, and then they go into the office and they don't have it? That's sort of the question, right?
Okay.
Yeah, and it's interesting because I did have a director say to me that they are much more comfortable working at home, even though they're happy to be coming into work to see people and work with their team, that they no longer are comfortable because they're just bringing their laptop into the office. So they've established with MGC equipment a very comfortable working arrangement in their home place, and now don't have that at work. So this actual provision is a real practical issue. Are we going to support, to make sure that there's no disincentive to work well at the workplace with your team as a manager? Or are we really going to make them come back in with their equipment that they've now set up at home and return it to the office? Are we going to just decide to invest in the setup?
So this has been a conversation, and we're working with IT, and it really is unique to managers because for non-management employees, a lot of it is one cube is another cube, especially since we've gone to digital records. You just find a cube plug in your docking station, to the Thunderbolt, and you can off and run. I think a workable solution would be some managers sharing offices if that's the case. I know I plan on moving out or taking some of the equipment from managers' offices who have established areas and redistributing it across the floor. So this is one that we're going to have to work through as we go in and see all of the issues. We have not taken off the table buying more equipment, but I know if Katrina were on here, she may pull her hair out of managing additional equipment for this initiative. But I know for myself, anyone wants to use my office, they can go in and use it, because I plan on going back and working out of a cube for most of the time and using the office as a team room, so that we do have that ability to do private work in that area.
I appreciate that, Derek, and you've shared that with me before, but this would be, I think, there's probably some directors who might not adapt that approach. And I think it's an interesting dilemma, because, you don't want it to be a disincentive to come into the office.
Yeah, and I think this is one of those ones that we've identified in the working group, and we're just going to have to see what happens when we go back in. But there are people that are working fine from home with and have gone out and bought extra stuff, which means there is extra equipment in the office to be distributed to those cases. And I think we'll just have to figure out as they're identified. Like I said, I have 2 monitors in my office. I think Trupti still has 2 in her office, and really, those are 2 monitors in my office that could probably be redistributed to a director that needs them when they come in, because I'll just plug in at a cube and do like I have here. I'll tent my laptop as one monitor and use the other monitor that's in the cube as a monitor.
So that makes sense. So Karen, maybe what I'm struggling with a little bit here, just in terms of the language, is that it's focused on making sure the home office is really well equipped to be able to perform, and to be able to perform comfortably and safely.
Right.
And in turn, I want to make sure that the workplace has comfortable and work arrangements. And so maybe you work with each of your managers to say, hey, what's your setup at home? What's your setup at work? Let's make sure that it works for you equally, so that when you are on your couple of days at home, it's really good, and when you're at work, it's really good,
Right.
As opposed to a compromise, right?
Yeah, I think that's 100% correct. Like, we can't compromise the sort of the work product. For example, financial investigators that are doing, complicated analysis, that are using multiple screens, if they can't come into the office one day and just have a laptop and maybe one screen, it has the work product has to come first, because that's why we're all here. But it's funny, because I had a lot of consternation about this whole equipment thing at the beginning when we were talking about this. I have less anxiety about figuring this out as we have gone along. I think that given the number of employees we have that are not in offices, and given the functions of managers, I actually think this will work out. But to your point, you have to have, wherever you're working, you have to be properly equipped. And, whether it's, and that includes the office, because to your point, if you're working on a laptop at the office and you got your setup at home, nobody's going to want to come into the office. So that has to be solved, and you have to have a good setup at the office, and then we'll figure out sort of the secondary location. But I do think, based on the equipment that we have, and so the flexibility, I think we're in pretty good shape based on some of the communications I've had. And I think I was somewhat in the same position. I was very concerned about this for a while, and I have less concerns based on sort of the logistics. But that's part of, to Derek's point, that's part of the test period. Let's identify where the gaps are, and where we may not have recognized that we have an issue. So that's why it's this pilot policy. So,
Commissioner Zuniga.
Yeah, no, I think that's all right. I'm glad that you have that approach, Karen, and I think the solution really is what Derek implies by his his example with Trupti, that pooling resources, is going to get perhaps a lot of people in the optimal setup on both home and office. And I should say that I think also it was implied earlier that maybe low cost, high return investments in a mouse or another docking station here or there might also get us all there, especially when we are potentially and hopefully thinking about our lease renewal, which is not imminent, but eventually it'll be a conversation where there will be perhaps opportunities like the governor's office has been doing with agencies to reduce some footprint if we adopt these more fully. But of course, I'm getting ahead of ourselves. This is a testing piece, and I think it's the right approach.
Any other questions or comments on that? Any other suggestions? Okay.
I'm good.
Okay, really helpful. So the other piece that I highlighted here, just for the discussion, is this, and we reworded this a few times. So this one was a little bit tricky. So it's basically, what do you do? What do you do if the person's working at home and the internet goes out or the power goes out? What do we do? So obviously, your power's out for 3 days. You don't want employees, oh, my power's out, I'm supposed to be working remotely, and then they, are not able to work for 3 days. There's a common sense, I think, aspect to this. So what we sort of settled on, at least for now, and certainly encourage some input here, is just if a temporary loss of internet or utility connection causes the employee to be unable to perform their duties remotely, that employee shall inform their immediate supervisor of the issue as promptly as possible. Supervisor should develop a plan for continuous operations, which may include going into the assigned work location or using vacation or personal time for the period of such interruption. So it may depend on the ability to work. So for example, if an employee has work they can do and they're not dependent on the internet connection, even if the internet's down, if they can still do work, they're still working. Just coordinate with the manager and you still do work. But if it's going to be an extended period of time, it may be that you have to go into the office, even though you were thinking you would, be working remote the next 2 days. So it's just sort of a common sense. This isn't. There are going to be issues. We've seen it. There are sometimes connections or problems, and and I think there is also a line here that the internet connection or having accessibility to being able to work with your colleagues is incumbent on the employee. If they don't have that, it's not going to work. We're not mandating you to stay home or giving the opportunity. So if if that is not available at the remote work area, then we have a place for you to work, so we can make sure that you can get your job done and be successful. So that, there was a few rewrites of that. So certainly interested in any feedback on that, or any, if there's a better way to phrase it, or just confirming that the commission is comfortable with that approach before we finalize this document for your consideration. Any thoughts?
My only addition is that the employee should cross their fingers and say a few prayers and try again, and then check in with their manager. We've all been doing that throughout this last 18 months.
I think it's worth noting, our IT department, they track everything. So they track the service calls, and there is an enhanced amount of work for the IT department when people work remotely. There are more calls for service when people work remotely. So, it'd be interesting to look at the data and see, when we go to say this average of 2.5, does that cut? How much does that cut? And does it cut down the service calls and things like that? So, be interesting to see how that plays out. But there are resources being used at the commission in order to allow for this remote working, and they've been very effective. And if you've ever called the help desk, they're so helpful. So I'm really grateful for all the work that they do.
Well, Eileen and Gail, I'm sure you guys discussed this, but I'm very comfortable with this language. I know that everyone will appreciate this flexibility as a privilege, and they're going to want to be able to work. So they'll just work it out the best they can.
Right.
I agree. Can I, Karen, before you move on,
Yeah.
this is a minor issue, but it might not go without saying the prior bullet to what's highlighted over there in the screen relative
Yes.
to protecting information. I thought of the perhaps uncommon, but it could happen, a situation in which somebody goes into a public place, let's say a cafe, to connect because there's a good Wi-Fi over there or whatever the situation. And which is still working remotely, but not technically in a home setting.
Okay.
So I would just like to see something to the effect of protecting information, including the information that other people may see just by looking at what you're seeing.
Oh, I see what you're saying.
If you are in a public place, that's not too. I mean, that has not been an issue, is my suspicion so far, because, there's this pandemic. But as this becomes less restrictive, hopefully, we need to be thinking about that.
That's a really good point. I mean, I did see that it refers to a secure connection when you do use a public access, which I think we could all use some training on these things, right?
Yeah.
But on the securing the documents, and then, of course, reporting if something happens, and things can happen. You could have your files in your car, and the car gets broken into. Just always a responsibility to let people know.
Right.
We can always work on that. No one should be fearful if something does get lost or picked up by potentially the public.
Right.
Okay.
Just a matter of reporting it. Mm-hmm.
Okay. So maybe for purposes of process, maybe if I could work with Commissioner O'Brien and Commissioner Cameron just on the language and have them as members of the working group confirm the language, but we'll add something on. Basically, the concept is you're protecting any information in any location in which you're working.
Correct.
Okay. All right. So let me add that. That's page 3. Okay. All right. Anything else before I move on to the next page? Okay. There's information, safety, and then the procedures. And basically, as Derek had also highlighted, this is really connection with the manager and the employee and working these things out and making sure it works. And then the proposed plan is outlined in the written submission shall initially be approved by the manager and or division head and subject to the approval by the executive director. So the manager is going to know sort of boots on the ground what's sort of going to work in a particular division, and then but ultimately it also has to be checked. So there's 2 places where it would be checked, and it would be in written form. So there would be some really common understanding with the employee and the manager what's going to work. And then those managers are also, as soon as I say that, some managers report directly to the executive director. So I would just approve those directly unless the commission wanted some kind of secondary approval by a commissioner. I just thought of that as we were discussing that. So, or because I have a number of direct reports, so I could either just approve those if you wanted any kind of secondary approval. I could go to a commissioner. Any thoughts on that?
I'm fine with your discretion, Karen, and then taking it. If you think that you would want confirmation, that's fine, but leave it up to you.
I agree with that. This is the appropriate way to go as to move forward.
Karen, can I just ask, does this policy, I may have missed it, does it allow you to call everyone in if you wanted the whole team in for either on training or an in-person event, cultural stuff that I was alluding to? Does this allow you to do that? I don't know if you have to have that in this policy, so I really refer back to the working group on that, because I understand it really is a policy about the flex time, but and obviously you can override the policy, but that's not what we're talking about. Just those a day where it's office day or something.
not specifically in there, but I think the opening description of the policy is that this is all subject to making sure that the agency functions the way it needs to function. So an inherent in that would be the ability to say, you know, we need you in, but we don't have anything that specifically says either the commission or the ED has the authority to say you need to come in. I mean, the implication is even the supervisor could say to an employee, we need to have a team meeting. And so you need to be here on Wednesday, even though that's not normally your day, because to function, we need you in. That's implicit in this, in the opening discussion, but I don't know if it needs to be put in there more clearly.
We could add a line.
Two of you.
Yeah.
Sorry, Karen.
I'm sorry.
Go ahead, Enrique.
I think it couldn't hurt. Maybe one more sentence to the effect of, of what Eileen was describing. The director, the executive director, or any director can, call the person in on a particular situation, but the rest would be enough flexibility.
Okay.
But it would be, again, at their discretion or for whatever particular situation.
There is a bullet on page 2 allowing the suspension or cancellation of a flexible arrangement. That sounds like in its entirety, and maybe another sentence in that around that location with the discretion.
Although I'd like it to be framed in a positive rather than, like a negative. It's more to build the culture. Sorry, Eileen, go ahead.
I think it needs to be framed more in terms of the needs of the organization at any point, may require you to come in, notwithstanding any sort of flexible arrangement.
Oh, that's good.
Separate and apart, what Loretta just recognized, because that is more, we're suspending it for some either, malfeasance or some other reason.
Yeah, that's how I read that bullet too. One issue that came up informally, Karen, I know that you and I discussed, I'm not sure if you discussed in the working group, commuting costs. There's not going to be any change if it's, let's say it's a day where you normally are home and you're asked to come in. The commission doesn't absorb that, correct?
Correct.
Okay.
Karen, just to
ahead,
back up on that and add clarification, remember the hybrid work is a privilege. It's not a requirement once it goes into effect. So that's why we wouldn't be reimbursing for the commuting costs when you come in if it's a day that you would have the privilege of working from home, because that's a lot of analysis went into that too, right? As you set these up, and how to make sure that we're not violating any rules as far as home offices or anything along those lines too.
Thanks. That's a good way of framing it, Derek. Thank you.
Yes.
This is really good work, guys. Thank you.
So that goes to the pro. So I've got 2 changes to the policy as written in the packet. One would be protecting information at a location, and the other would be the needs of the organization may require attendance in the office for certain activities or events. If with the commission's permission, I'll just work with Commissioner O'Brien and Commissioner Cameron to draft the language and get their thumbs up on the language, and then we would implement the policy as they approve. Is that fair?
Sounds good.
Okay.
So we'd vote on this and with just subject to those couple of changes.
Correct. So delegating authority for them to approve. I can work with the group on the language, but they would approve the final version with those 2 sentences.
Can you take down the memo, please? Great. I just wanted to see faces. Commissioner Cameron, are you comfortable with the discussion and the recommended changes, or is there anything we've left off?
Very much so. The group did so much work. The team really thought about lots of possibilities, did an awful lot of research. really brought us information from their teams about how people were feeling, and so it helped us consider every option when we move forward with this. So yes, I am
Right.
totally in favor of the recommendations.
Yeah. And Commissioner O'Brien?
Yep.
Okay, and is there anything that we didn't think of that was something that you think we should be chewing on, and you feel that the document really reflects the work?
Absolutely.
Excellent. Okay.
Well,
So
I'd
Karen,
like to, can I would also like to say that even though I wasn't part of the working group, everything that you described, Commissioner Cameron and Karen, and about all the work and thought that that went into it is clearly comes through in as you presented it, and we discussed it, and of course as we read the memo and the key areas. So thank you for all that work.
yeah, excellent work. And maybe it's the time to recognize who was on the committee, Karen, before we move in a more formal fashion.
Yeah, so Gail Cameron, Eileen O'Brien, Loretta Lilios, Derek Lennon, Tripti Banda, Todd Grossman, Katrina Jagrup Gomes, and Joe Delaney.
The last person?
Joe Delaney.
Oh, great.
Came in towards the end, but it was a really good addition. Joe's been great, so very helpful.
Great. Good. Yeah, thank you. I know that the work has been going on for a while, but of course, as COVID extended, it's made things more complicated. You don't have a date for the pilot program to be implemented, and I heard you mention that, Karen, but I'm not sure about how that gets resolved.
So my suggestion is we deal with the next issue of the vaccination policy, and that will inform the start date, because if there is a change in what our policy is with respect to our approach to vaccination, that would potentially impact the start date and how much lead time we need. So maybe the vote is subject to the agreed upon reopening date, which will be voted on later at the meeting.
Sorry if I missed that. I may have just had Zoom ears and didn't quite hear that. So thank you. Thank you. Okay. Commissioners, then I guess it's mainly been you and me, Enrique, who had questions because we weren't part of the working group. Do you have it? Are you all set now? Okay, and I am too. Thank you again, and such excellent work, and thanks to the entire committee. Does somebody want to move on this? Because you do want the vote. Commissioner O'Brien?
Certainly. Madam Chair, I move that this commission approve the proposed pilot program for flexible and remote work arrangements as included in the commissioner's packet and as further discussed and amended here today, subject to insertion of the start date and end date at a future time.
Second.
Thank you. Any comments or edits to that motion? We're all good? Okay. Commissioner Cameron.
Aye.
Commissioner O'Brien.
Aye.
Commissioner Zuniga.
Aye.
And I vote yes, 4-0. Thank you, Vivian, and excellent work. Thank you. That's a big check mark, Karen.
Yep.
Moving on to,
yeah,
it is a big deal. Thank you so much. Then moving on to item 2.
Okay, so the second item is regarding the vaccination policy. So as I'm sure everyone is aware, we've seen government agencies, both in Massachusetts, across the country, they're evaluating and implementing policies regarding COVID-19 vaccinations. We've been tracking what's been going on across the state, across the country, and we'll see it has been emerging, and there has been groundswell of support for requiring vaccinations and at least requiring proof of vaccinations in order to give the employees some more comfort that their other fellow employees are at least, if not vaccinated, then they are wearing masks. So, I have a brief memo in the packet just outlining, what the treasurer and state auditor did, and they announced on July 29th that they were requiring that employees show proof of vaccination against COVID-19 or submit to weekly testing at their own expense upon the return to the office from remote working. And additionally, unvaccinated employees were going to be required to wear masks. And then on August 4th, Attorney General Healy announced she was going to require that all her staff in the office be vaccinated against COVID-19, except for medical or religious exemptions. And similarly, on August 19th, Governor Baker issued an executive order requiring all the executive department employees to provide proof of vaccination against COVID-19 on or before October 17th, 2021. In addition, that guidance, as new guidance was coming out regarding booster vaccinations, that was going to include that employees be also required to provide proof of booster vaccinations as recommended. Similar to the policy by Healy's office, employees for whom vaccination was medically contraindicated or who were subject to object to vaccination on grounds of sincerely held religious beliefs may be entitled to an exemption. So right now, we were tracking the executive branch policy with regard to vaccinations, and we did require that anyone at the MGC who was not vaccinated was required to wear a mask while at work at any MGC office, unless they were seated alone in an office or at a workstation. We currently do not require proof of vaccination status from employees consistent with that prior policy of the executive branch. We did discuss this again yesterday at the working group. My recommendation is, given the established safety of the vaccine and what we're seeing as far as public health and best practices, I am recommending that we go with the executive branch and consistent with the Attorney General's branch's policy to require vaccinations of employees at the Massachusetts Gaming Commission. There may be a required lead time for that. I recognize that. And in the interim, it's my recommendation that we establish a policy requiring proof of vaccination and require mask wearing and weekly testing for any employee with a presence in any MGC office space until such time as all employees are vaccinated. And then I also recommend the MGC policy allow for potential and medical religious exemptions to be addressed on a case-by-case basis. So this is serious. This is I think, the best way forward to protect our employees. And my recommendation is that we do the same thing that the governor and the attorney general doing with all those agencies. So.
May I note also that it's not only your recommendation, but that of the working group. There was a consensus after discussing this in length in our meeting yesterday that this was the appropriate way to move forward.
Thank you, Commissioner. Questions, Commissioner O'Brien or Commissioner Zuniga?
No, I agree with the recommendation. This came up early on in terms of our discussions with the working group. I was in favor of being more conservative with the requirements in terms of protecting employees. So I absolutely think, given the current state of affairs, this is the way to go.
Commissioner Zuniga?
I agree. And one thing that was implied, but I'll say it in Karen's remarks, at least one vaccine is now fully approved by the FDA, which may have been perhaps a hesitation by the executive branch and others until recently to move the way they did. So I'm completely comfortable with this recommendation, and I think it's a very good public health practice.
Karen, excellent memo, very, very helpful in guiding the discussion, and I appreciate the working group's input on this as well. I do have a question about time frame. I see, if I understand correctly, that it sounds as though the governor's or the executive branch's time frame is that folks have to show vaccination, or is it vaccination underway or vaccination completion by October 17th? I'd love it if we had a time frame here to work from.
Yeah, so it looks as if the governor gave, if not exactly, approximately 60 days for the full thing, for the full vaccination status. That is my understanding. So that sort of impacts sort of the start date of the office, but there are certain options. We can give a date where employees may be fully vaccinated. Something you and I discussed and you had suggested, but it's also we could also require a more immediate proof of a vaccination appointment. It's not that difficult to get vaccination appointments. And if there's an employee that cannot show proof of vaccination, instead of waiting the 60 days and then finding out, oh, you never did anything about it, well, maybe you have to show within X number of days that you have at least a vaccination appointment, or you've got the process started. So this is all about protecting our fellow employees, and I do not think that's unreasonable.
So assuming that we were to adopt this, what would be for the first step? What would be the time window for us to, I assume it would be taking a photo of our vaccination cards and submitting it to HR? What were you thinking in terms of the time frame for just that first piece?
Similar to what the Attorney General's office, where they came out with the announcement, we will still need to actually draft an actual policy on sort of the details on the process. So I think we could potentially do that within a couple of weeks. So it may be that we put employees on notice now. This is going to be the requirement. The notice of what I've heard is that other agencies are setting up an email account. It would be a separate private, within the MGC and MGC mass.gov account. And that would be where employees would submit pictures of their vaccination cards. And that has been the process, which seems to me a reasonable process. They can also, if that doesn't work, they could also show HR in person. HR could take a picture of that. They wanted to come into the office, and we could make arrangements for that. That's what I've heard as far as process. So we could, if the commission is comfortable, we could get going on that process right away. And then we'd have a better understanding of how many employees are vaccinated versus not vaccinated. I don't know right now what the percentage is. I'm hoping it's very high, and this is just a limited number of people that would need to go get vaccinated. But my thinking is that, and I don't know, Derek or Tripty, if you have any thoughts, or if you've heard anything else about process and how quickly we could implement.
So I haven't heard of anything on process, but I know that that IT will want to weigh in on this to make sure that whatever location we have it set up on is pretty secure. So we do have to go through some of that information, because you'll have people's names, the dates of their vaccinations on their cards, and the type of vaccine. So I know IT will want to weigh in on how to do this, and probably not in a public meeting, just so that we don't show where that data is sitting. But that shouldn't take that long. I mean, they've spun around secure transfer sites up. They've spun those up in a day or two. So they have the vaccine cards in and that information. That shouldn't take longer than a week. And then writing up the process is what you're talking about. Do we want it proof that you're getting it if you don't have it already in 5 days, and that you're getting tests, and how are we monitoring that, and how are we getting it through? That'll be the thing that takes a couple weeks. I think that was a discussion in the working group. Correct me if I'm wrong, Trupti and other members of the group.
I think it's important that we, define a timeline and share steps, and that's going to be a big part of the policy component.
I guess I want to just go back to our conversation with our licensees, commissioners, and we really wanted this policy in place immediately of our licensees with their employees for showing their proof of vaccination. I feel personally that there's some degree of urgency here, in that people are going to the office and people are wearing masks or not wearing masks. People are not necessarily identifying themselves as vaccinated, fully vaccinated. I know we also have the piece about the Boston, the mayor's new mandate that we need to discuss. But I do feel that many organizations now have required immediate proof of vaccination so that they understand their rate of vaccination. And it's done very, very swiftly. I've seen it in my own family. On the day of, the request was made and the photos were submitted of the cards. So I think that I would put I'd put a big degree of urgency on this. And if I'm out of step with my fellow commissioners, I'm all ears. Deficient ears, I must admit, but I'm all ears. So commissioners, speak up.
If I can weigh in, I think it's important to do this quickly as well. I was encouraged to hear Derek just say that he thinks IT can spin this up in a day or two. That's encouraging. I would hope today is Thursday, we could have something in place maybe as soon as, close of business tomorrow, where we have a plan anyway. Not that the whole process is completed, but we have a plan that works and is the level of security we need it to be. But yes, I think everyone's prepared to do this, or should be, and that it is an urgent matter to identify and start the process. I also, I think one of the things we talked about was the 60-day process for those who are unvaccinated.
Right.
And I do think what we talked about yesterday was not waiting the 60 days and then someone saying, well, I couldn't get an appointment. We know how easy it is to get an appointment right now. So maybe we give a week in order for someone to demonstrate that they are in the process of getting vaccinated. They have the appointment. I think that would be an important step as well for us planning and for this organization to move forward. So that was an interim step that we thought was somewhat urgent as well.
What we could do is give, as someone who's on vacation now and I don't have my card on me, if anyone's in my boat, a week might be a little too fast, but if we gave 2 weeks to say you've either got to get your proof of vaccination in or proof of an appointment, or if you're going to request a waiver, that the request for the waiver be submitted within the next 2 weeks, because then you'll have who's been vaccinated, who's queued up so that at the end of 60 days, they will have completed the vaccination period. And you'll be able to adjudicate and assess anyone if there's anyone who's requesting the waiver. And then you can put the 60-day date, which I believe came out to October 27th, in terms of the implementation for having to be completed with your vaccination and your 2-week post second shot.
So Commissioner Bryan, you're saying start the clock now, but give folks 2 weeks to get all of the required paperwork in place, whether that be proof that you have an appointment or that you're completed, you have your card into HR, or you have your request for an exemption. So the clock starts if we vote today in the affirmative to go forward with this policy. The clock starts today, but there's a 2-week process to get that paperwork in.
Right. I think the tricky part is not going to be folks that are vaccinated or folks that are going to get vaccinated. The tricky part is going to be what is exactly the policy on the waiver, on the medical exemption or religious exemption. I think that's the part that we may need some additional legal analysis. We may need to look at what's going on in some other state agencies. We don't know if we're going to get any of those. We might not have anyone that requests it, and then it's a moot point, and we might as well get going. But that's the trickier part.
But all they do is submit documentation to request.
Correct.
Right.
Correct.
I'm sorry. I'm sorry. I couldn't quite hear that. So Commissioner O'Brien, please first.
We don't need to adjudicate the request for a waiver or an exemption. They just need to file the request in writing by the close of the 2-week period.
And then Commissioner Cameron, were you weighing in too?
I was trying to say the same exact thing. We don't have to have the answer in 2 weeks. We need to have the request in 2 weeks.
And it's my understanding that the way that would work, at least from the executive branch, is that that's a request that it would be exactly what would be made through a typical HR request. And it would just be a case-by-case analysis. In other words, it's not just a general, I have religious objections. There's going to be more.
Right.
Let's be clear. The reason why we're having this discussion is we're not going to get over this pandemic unless we all work together, right? And so this is tough stuff, but we've got to take it very seriously. So the 2 weeks, Commissioner O'Brien, I'm feeling your pain because you're on vacation. I'm going to make a suggestion to everyone, though. Take a picture of your vaccine cards and keep it in your phone, because you may be getting asked this more and more. Can't go see the Eagles this week in the Madison Square Garden without showing your, vaccinations. So
just redact your birth so you're not flashing that around to everybody.
Wait, say again?
Redact your birth date so you're not flashing that around to everyone.
Oh my gosh, everybody in the world knows our birth dates. There's no privacy anymore. But, I just think it, just as a practical tip, probably most of you have done it just in case you don't, so you don't lose it. And I know there's probably going to be some digital developments that come out because of various security issues around the cards themselves. But how are we feeling? 2 weeks, does that feel urgent enough, Commissioner Cameron?
It made sense when Commissioner O'Brien explained it, but we're starting the clock now. I think that's the important piece. People can realize that this is happening, and they just have to take, just as soon as they can, we urge them to get that information as soon as there's a plan as to how to move it forward.
That's exactly what I would say is that we should stick with. I thought Commissioner Cameron made a really good point. If we can hear from Katrina and team by close of business tomorrow or early Monday, this is how you send us your proof of vaccination, right?
Yes.
And then everybody just get on board and send it. And even if there's a 2-week window, if you're in the situation where you may not have your card, just send it so that we'll have real intelligence about the rate of vaccination. That's a very important data point for us. If it turns out that it's lower than we expected, we may need to do something more urgent because we have to think about all of the health of all of our colleagues. If it turns out to be what Karen expects to be high, that's going to be good intelligence for us to get. So we really encourage folks to send it, and hopefully it will be an easy ask. Doesn't have to be so complicated that it becomes bureaucratic and burdensome. But secure, of course. We have to understand it's important health information.
Right.
Commissioner Zuniga, you're nodding your head.
I agree. Yeah, I agree with all of this discussion. Sorry to be very precise on this one question, but I think it's conceivable. Hopefully it won't happen. But in the off chance that somebody has lost their vaccination card, because we weren't expecting when we got it months ago, I hope that we can accept something to the effect of a signed affidavit that they have been vaccinated. I really hope this doesn't happen, but is there an alternative to showing proof of vaccination without the card, I guess, is my question. If that ever happens.
I wonder if the person's personal physician might be able to weigh in on that.
Or go back to CVS or Walgreens or wherever you got it to see if you can back weigh in. Most physicians' offices didn't administer the shots.
So Massachusetts has a network. This happened with my daughter. Has a network where they are tracking where it goes to. So the physician's office knew that my daughter got her vaccines and they were at a CVS. So there is a way that they can get some confirmation from their physician.
Okay.
That doesn't work for every physician's office. So like my daughter's pediatrician did not get notification from CVS. We had to skip it.
That may be a possibility for some then, I guess.
Yeah.
We can try to find as many avenues as possible. I would suspect the CVS would have records that we could.
Right.
Yeah.
Well, again, we could cross that bridge on a case-by-case basis if we need to, but that was just one thing that came to mind I was
And-
very sure
Yeah.
to save my vaccination card because I knew it could, it might be necessary in the future, but that's not to say that everybody will.
Yeah, let's see if that's a problem, but I do think, honestly, every individual will be asked to have some credible proof. So an attestation may work, temporarily for us, but the proof will need to come ultimately. So,
Okay.
Karen, how do you feel about this discussion? Is there
Yeah,
anything
I
that-
think, I think to be transparent with the staff that, this is a big deal. This is a requirement. There would be, serious consequences for non-compliance or for any kind of attempt to, make up something or, do a false card. Like this is very serious, and we will take this seriously, up to and including termination. Any objection to that?
No.
No.
No, I think the moment merits it.
It does. It does.
Okay, so process-wise, then it sounds like what makes sense, probably a vote by the commission approving this approach, and then I will send an email to the staff today, basically summarizing this is the commission voted on, and that they would be getting information as early as the beginning of next week on how to submit proof of vaccination. And so we'd give the details on the process next week. Does that make sense?
Do you want the reference to the 10/27, 60 days from today, and that's the 9/9, 2 weeks from today, Karen?
Yeah, so the
It would
2
be like that.
weeks.
Part of this.
I'm not sure there's magic to the 60 days. That might be driven by not the vaccination rate, but by other discussions. So 60 days, we're saying you have to get your vaccination within 60 days.
You have to be fully vaccinated. So when you think about scheduling a shot, waiting 3 weeks, scheduling a shot, waiting 2 weeks, you're looking at least, 5 weeks?
Okay.
We were being consistent with what others are doing in state government.
Right. Oh, I know. And I just know that the 60 days may not have been from the executive administration, may have been derived from other discussions as opposed to the vaccination rate. But you've raised the right point. I guess it was 3 weeks after your first dose. Is that what it was?
Or a month if it's the
Or-
Moderna, right?
If it was
Yeah.
Moderna, perfect.
Right.
I had to wait
Okay.
a month.
5 to 6 weeks, so.
Okay, so 60 days is fine. Thank you.
Okay. And then did you calculate the 60-day mark, Eileen? Did you give me a specific
I
date?
went out 8 weeks from today, which is 10/27, October 27th. And then 2 weeks from today would be close of business by Thursday, September 9th.
Okay. All right. I can double check if the 10/27 is that we can do an actual 60 days, but
Right.
you want to do the 60 days? So we're around that. Okay.
Might as well be consistent as Gail says, yeah.
Right. Okay. Check. Okay. So I'll put that in an email to the staff. My expectation is that overall, the staff is really going to be happy with this. I think that's sort of the feedback managers have reported to me, is that people want to know that other people are vaccinated, that the agency is taking care of them and ensuring that other people are vaccinated and prioritizing their health. So I think my expectation, this will be welcome, and it's a sign that we are taking care of our employees and we're prioritizing their well-being, and we're trying to do our part to get past the pandemic. And it's a very positive step.
And my hope is that if there was, for whatever reason, somebody hesitant to do it, that this would be the time to then go get vaccinated.
Okay, so I think maybe if the process would be a vote on this, and then, as Kathy mentioned, there is the Boston directive. So given that we're talking about the Boston offices, you probably should clarify that.
So should we just work right now on the vaccination policy first and then move to the mask discussion? Okay. Commissioners, I know that you've been able to, you've given us the privilege of asking a few more questions because we hadn't thought about it as in detail as you, Commissioners Cameron and O'Brien. So thank you. I'm all set. All my questions are answered. Enrique, are you all set? Okay. So do we have a motion for Karen on this?
Madam Chair, I move that the commission establish a policy requiring proof of vaccination against COVID-19 and require mask wearing and weekly testing for any employee with a presence in any MGC office space until such time as all employees are able to be vaccinated. In furtherance of this objective, I recommend that the full vaccinations be concluded within 60 days and that documentation be submitted to Human Resources by close of business within 2 weeks of today, which is September 9th, 2021, either offering proof of full vaccination, a scheduled appointment to commence vaccination, or any request to be exempt from the vaccination requirement.
Second.
Excellent. Thank you. Commissioner, I'm assuming no questions. Commissioner Cameron.
Aye.
Commissioner O'Brien.
Aye.
Commissioner Zuniga.
Aye.
I vote yes, 4-0. Vivian, thank you so much, and thank you for the thorough discussion and work. Okay, Karen, in terms of the Boston mandate.
Yes, so, and I know Carrie's on. I don't want to put you on the spot, Carrie. I know that Tripti reached out to you yesterday. So the Boston Health Commission did put out an order, and Carrie did take a look at that as far as exactly what the requirement is. I don't know, Carrie, are you available or prepared to just sort of give a brief summary of what you looked at yesterday?
Yeah, sure.
Oh, great, thank you.
So the Boston order, the order from the Boston Public Health Commission really identifies that it requires face coverings or masks in areas that are, let me find the exact language, places that are open to members of the public is the exact language that it uses. It identifies some examples of those places. It doesn't specifically say office buildings. It does include municipal buildings in the examples, but that doesn't include state office buildings. So I think if you look at the language in terms of areas that are open to members of the public, it would apply to, of course, in our building, the building lobby, the elevators, and the building sent out messages. It would seem to apply to our office lobby, our public meeting space, if we were to go back to meetings in that space, not really to our internal office space. So I think that it's really within the commission's discretion to decide whether or not to require masks within our internal office space.
Can I add to that? We did talk about this. I believe there's a strong recommendation that goes with this at the further down, Carrie, which says in private offices, it's strongly recommended that masks are worn when you can't distance. So do you have that language at all as part of this? I think it was down a little bit farther in the document.
I don't have it open right now. Let me.
Okay.
Grab it.
I think this was a late night ask, if I.
Yeah, it definitely was. And Joe, you had found that at some point. Do you have that, where that's located? I know Joe found it when we were discussing that yesterday in the working group.
Yeah, let me see if I can find it. It was on the Boston website. No, as I'm looking at this, there's a different, the final order doesn't seem to have those strong recommendations. That was just on a summary, I think, that was on the City of Boston website.
It may have been in the summary on the city's page. I don't see it in the order itself.
It might have been reflecting CDC guidance.
Right.
I don't know if that's the language of the CDC guidance, though. If it strongly recommends or indoor. So it sounds as though it's not part of the mayor's order, that there was a recommendation around our office space for masking. Karen, with that said?
Right. So, yeah, so it sounds like for folks that our offices are not open to public right now. So between now and say the date at the end of October, they're still not open to the public, but we have people, some of the troopers are working there and we have people periodically going in. So the question is, it sounds like it's not mandated. We could, if I send out my email, we could recommend it if we wanted to recommend it consistent with, CDC guides, if you're going to be with people, or we can, given that we are now mandating vaccines, do we want to just wait until that, that whole policy is implemented? We are tracking who's going in the office, and there's only a very few people in the office.
Maybe the recommendation could be, if you're not able to distance in the office, it's a strong recommendation that you mask.
I think I would stay with my stated position, which is we're not the public health experts, and that we would follow this mayor, because our office is in Boston, this mayor's guidance around masking. It was strictly with respect to public, but of course anybody can always choose to wear a mask. But again, if the commission votes on some recommendation around masking, I think our team would take that very seriously. And again, I just think that I'm going to stick with my position is, the local mayor has made her decision on this. The governor's made his decision on the state. And we're following that.
I wasn't in any way thinking we should vote on this. Because
okay,
I don't think, not at all. I was just saying you want to recommend if you happen to be in a setting where there's no distancing, just a recommendation that you mask in that particular setting, which sounds like it's not an issue in our office, by the way, because there are so few people going in.
I think that's right. Although the mayor appears to have issued that recommendation and deferred to private places, in our case, which is what we're talking about. But I'm on board with that recommendation.
But they must wear a mask if they are not vaccinated.
Correct. That is 100% correct.
Must wear a mask if they are not vaccinated. There's no shame in wearing a mask if you are vaccinated.
Absolutely.
Right.
And I can direct you to it's on the City of Boston website where Joe's talking about. It's under the boston.gov/news/what you need to know about mask requirements. And it's under the recommendations section where it says it is strongly recommended that masks be worn at a private indoor setting with people outside your household. So it is on the Boston website. It is a recommendation, but it did not make it into the policy, which is correct. This is just a recommendation of how to further protect. I think that goes into where we were looking at information yesterday. And does it pertain to public health orders, and where we said, yeah, there's nothing that actually requires it, but it's a good recommendation. So just wanted to give the site that Joe had from yesterday.
And that applies to regardless of vaccination status, right? That as you said. Yeah.
Yes, that's regardless of, and it goes back to that masks work if everyone wears them, right? And this Delta variant is able to be transmitted in fully vaccinated adults. And some people have immunocompromised people that they live at home with, and some people have unvaccinated people that don't have the option of being vaccinated because they're under 12 that they live at home with. You know, I think that's where that recommendation comes from versus a actual requirement.
And that's consistent with the governor's
Yeah.
policy and mandate, yeah. That it's an individual-based an assessment of risk. Yeah.
Correct.
Understood.
It never helps to remind people that, you know, what these recommendations are, because they may not have seen the same sites
That's
or
right.
news that we see. So
That's
it's just
right.
a reminder is, I think, important for our team.
That's right. And Commissioner Kimmer, there are actually yesterday quite a few, I was in the office, there were quite a few of our teammates there. And so again, this is, you know, guidance that we can, you know, remind people of. Everybody should be comfortable. But there is at least one mandate, and that is if you are unvaccinated, you must have a mask on at all times when you're with your colleagues.
So I'm wondering, Madam Chair, then if it makes sense, if I send an email out on the you know, the decisions the commission made, and then maybe do a link to the Boston information and a reiteration of the current policy that unvaccinated employees must wear masks in our office space. Does that make sense? Do you want to? Should I send the link to the Boston for the Boston? Any thoughts on that?
That's hard.
Right.
I think
Or is
that's,
that going to be confusing for people? I don't want to confuse anybody.
I don't think it's confusing. I think it's the latest information about what's recommended. That's all. I think it's, and to have the actual language make sense as opposed to something we paraphrase.
And it's really important for them to have their masks on in the lobby and in the elevator. That's really important. In the hallways, in the bathrooms, garage.
Right.
Yeah.
Right. Yeah, and Marianne was super helpful while I was on vacation. She did send that out office-wide, that information came out. So I was really grateful that she did that. She was on top of it.
Yeah. Do you need anything further from us on that?
No, that's helpful. So I don't need anything in that. There's no vote. So I think then the final issue is the Boston office reopening date and what the commission wants to do.
So what we thought about in the working group, and Karen, did you want to take the lead on this, or did you?
Please go ahead.
Yeah, no, what we thought about was matching it with our decision today about vaccinations and going the 60 days to reopen, so that everybody will have that comfort level that everyone will be vaccinated by that time, or they will not be in the workplace. So there is no guessing at that point.
That makes perfect sense to me.
So do we do the Monday after that? Because that date actually falls in the middle of a week.
Yeah, so the next Monday is November 1st.
Can we have an October date? I don't know.
Like 11-1 makes the most sense, though. I mean, because we have 27th for everyone to get done, and then you'll have 2 more days that week. You know, it would make more sense to start on the 1st.
Well, if we go back on the 27th, it just seems like we're getting out of line now with a lot of organizations. I know a lot of organizations, people are working in their offices. So
I know a lot going back until January, so I
guess that's right too. So it doesn't matter. But in terms of the October 27th, that was really 60 days.
Wednesday, and that's close of business. So you're talking the first day after that is a Thursday. So to me, the 11-1 makes more sense.
Okay.
Fine as well.
Doesn't matter.
Yeah, I'm comfortable as well, just to put a whole plan in place that makes sense.
And that will give plenty of time to get office equipment in place, home office equipment in place, energy around the physical plant in place, ideas for all MGC, activities, Karen, to be putting on the agenda. That's a lot of lead time now. So it gives, I know that helps you for that kind of planning.
Yeah,
as we-
I'm also looking at the dates for the commission meetings, and I think so the commission meeting around there would be the November 4th, if we keep on the 2-week schedule. So we'd be back in the office on the 1st and then a commission meeting on the 4th.
I do want to add a couple of things about the commission meetings, and one of them is that I will need my colleagues to come in to work with me and the team on the technology. There's a current proposal that technically works. It has some challenges in terms of management from my perspective, and also from the engagement of the commissioners. If we're in person, it's a different experience. So I'm hoping that during this interim period, there'll be opportunities for us, even though I know we're not opening the offices until November, that we do convene together to get this training. And I believe we have permission in open meeting law to work this out. Otherwise, I invite anyone in the public, if they're interested, to come help us brainstorm on the solution. So I am looking for a couple of opportunities where we meet in person. The other will be around the onboarding of our new commissioner. So, and I know we're also going to be meeting in person in September for the international conference. So there will be just a few, maybe that we can even leverage that a little bit to figure out the challenges of the technology. Karen, does that make sense? Karen and I have done one
Yeah, we did a
excellent
test
training.
run. Yeah.
Yeah. It's pretty cool. It's just, it's still, I'd love insights from everybody to, you might come up with great ideas. And this is a hybrid arrangement. And our decision will be, do we adopt that? Which is a little bit different than what we were discussing today. Does that sound okay? I know Commissioner Cameron, you've got some scheduling issues, but I'm wondering if in September that might work for you.
No, I'd be interested in learning actually because
Oh, great. I thought so. Yeah. It's interesting technically, and then it's also just, we need some good brainstorming. Okay. All right. So we need a vote then on the.
Did we vote on the date? Did I miss that?
No, we need to have a vote.
Okay.
I was just before we voted on that, I was getting some buy-in to still come in before the official reopening date of the offices.
Right.
Commissioners.
Well, and that's probably really important for the staff to know that you can still come into the office before November 1st. We have a process for that, and the people that want to come in and do some work in the office is an option.
I think that's important for everyone to know. I know some people have been going in because of their own mental health. They need to get out of their homes. So it's I think we can convey it's been a safe environment to go into, and it does offer an opportunity to bump into people. And with that said, I want to note that we do have a new colleague here before our vote, Heather Hall. Loretta, I know you're going to probably formally introduce her, but literally I bumped into her in our office space, and we were able to meet in person rather than virtually as we had anticipated. So welcome, Heather and Loretta.
Thanks, Kathy. And I do plan to acknowledge her at a later time at one of our meetings, but I am absolutely over the moon to have her on board with us. She's had a career thus far as an attorney in public service in multiple environments. I know she's excited to be on board with us, and it has jumped right in to all of our many interesting projects.
As Chief Enforcement Counsel.
Yes, I'm sorry to leave that out. As Chief Enforcement Counsel, a role that is near and dear to me. So very happy to have her on board.
Yeah. So it was interesting because I got to meet Heather in person before I met her virtually. So there we are. So
thank you, Chair. Thank you, Loretta.
Thank you, Heather. And it looks like you're in the office today again. Joe, are you in the office? Yeah. And by the way, the building has walls across the way now, glass walls are, yeah. So, but beautiful. So we have to have a vote for the date, Commissioner O'Brien, that you calculated would be Monday, November 1st or 4th? Okay, 1st. All right, Commissioner Zuniga, you want to make a motion?
Sure. I move that the commission determine that return to the office be the date of November 1st of 2021 in accordance to all of the discussion hearing today.
Okay,
Second.
thanks. Commissioner Cameron,
Aye.
Commissioner O'Brien,
Aye.
Commissioner Zuniga,
Aye.
and I vote yes, 4-0. Great. Any other business? Commissioner Cameron, anything on the update on the international?
Nothing after the update last week, thanks.
Do you think that if the mask requirement doesn't change by then, does that apply to hotels?
I believe it will, because it's a public setting.
Okay. Let's all say some prayers that things shift in the right direction. All right, everyone, stay safe. If there's no further business, I'll take a motion to adjourn.
I move to adjourn.
Second.
Second.
Thank you. Just a big thank you to the entire team. This was an important meeting and all the work that went into it, a lot of challenges, and it still seems a little bit surreal to me that we're having these discussions, but this was excellent work. Commissioner Cameron,
Aye.
Commissioner O'Brien,
Aye.
Commissioner Zuniga,
Aye.
I vote yes. Thank you. Thank you, Karen. Thank you very much.
Thanks, everyone.
Thank you, everyone.
Bye-bye.